While occupational violence is often considered synonymous with physical assault, it also encompasses a range of behaviours that may put the well-being of staff at risk and patients at risk, including threats, harassment, intimidation, humiliation, insults, and inappropriate behaviour.
We know the experience of occupational violence can be incredibly detrimental for healthcare workers. So what can be done to reduce its incidence? First, we need to know what knowledge is available for translation into practice. This study is the first of its kind, addressing the issue of occupational violence and acute health from an explicitly knowledge translation perspective. The scoping review undertaken at the beginning of this study has reviewed 814 articles published on this topic since 2005. And here's some highlights from our findings. The majority of evidence originates from the USA, the UK and Australia. Most studies focus on physical assault, including verbal and physical aggression or abuse. Mental health inpatients, nurses and emergency department staff are the main sample groups in the evidence.
The vast majority of studies have used quantitative methods, and almost all of these are descriptive methodologies. Most studies focus on identifying factors related to occupational violence and measuring the problem, with only a few moving beyond this towards intervention and prevention.
Screening assessments were prevalent, but very few studies looked at multifaceted interventions. In conclusion, we have lots of evidence about risks and impacts, but very little about what makes for effective interventions to reduce occupational violence. The next phase of this project will focus on synthesising more evidence and making it easily accessible for clinicians to transfer into their practice.